Hello everyone, my name is Yashwant Singh and today we will learn about humerus, which is the part of skeleton system of the upper limb. The humerus is a long type bone as seen here, and it consists of red bone marrow which help in formation of red blood cells in the body. The humerus have three distinguishable parts: the proximal epiphysis, which is the uppermost portion of the humerus. Then comes the distal epiphysis, which is the lowermost portion of the humerus. Then comes the shaft or the middle body of the humerus. Now we will learn about all of these parts one by one. The proximal epiphysis also consists of many important structures, which are the head of the humerus, the greater tubercle, the lesser tubercle, the crest of lesser tubercle, the crest of greater tubercle. Now we will also see a label diagram of all of these structures, as you can see here. This is the lesser tubercle, this is the greater tubercle. These are the crest of lesser and greater tubercle respectively. This is the head of the humerus, which articulates with scapula to form the shoulder joint. The joint in the shoulder is the ball and socket joint. Now we will study about the shaft of the humerus. The shaft of the humerus is a long structure which you can also say the body of the humerus. It do not consist of many parts. The main parts which can be seen here are deltoid tuberosity. It is a structure where the deltoid muscle, which is a shoulder muscle, connects to the humerus, and the radial groove. The radial groove. Now we will learn about the distal epiphysis. The distal epiphysis is the lowermost part of the humerus and consists of many important structures, as the elbow joint is formed here. It consists of condyles which help in the formation of the elbow joint. The name of the condyles are as follows. Capitulum is the condyle which articulates with radius, and trochlear is a condyle which articulates with ulna. Here we can also see radial fossa, which is found above the capitulum of the condyles. Then we can also find here lateral and medial epicondyle, as seen here. The lateral epicondyle will be on the outer axis. The medial epicondyle will be towards the center of the body. A coronoid fossa can also be seen here, which is found above the trochlea. These are the structures of the anterior side. Now we will concentrate towards the posterior side. On the posterior side, one can distinguish olecranon. Olecranon is a depression or a fossa you can see on the posterior surface of humerus. There is trochlear, as I already told you, through which the ulna articulates with humerus. There is also a group for ulnar nerves which help in passing of the ulnar nerves from this place and is found behind the medial epicondyle. Now we will concentrate on the neck of the humerus. Humerus consists of two necks, the surgical neck and the anatomical neck. The surgical neck is the place of the humerus where most of the fractures occur, and it is very important for clinical point of view. The anatomical neck is marked here in blue and the surgical neck is marked here in red, as seen. Now we will be working on the correct anatomical position of the humerus. The correct anatomical position can be easily determined by this way. It is a very important question and is often asked during the vivas. So first you have to distinguish between the posterior and the anterior part of the humerus. We should always remember that the posterior part contains these deep crevices, and the anterior part do not have such deep structure. So With this thought in your mind, you can easily distinguish anterior part from the posterior part. While determining the correct anatomical position, always remember that for the arm should be like this. The palm should be facing forward. Now we will determine. Now we know it is left. It's anterior and posterior. Now we will determine left and right humerus. The head of the humerus should always face medially. So while keeping these two things in mind, we can place the head here. Imagine this is the humerus and this is the head and this is deep dentation. Now what we can do is the deep dentation should face backward and the head should face upward. So like this, you can determine the correct anatomical position of the humerus. So that's all for today, guys. Don't forget to subscribe and leave a like. For the diagrams, you can check out my Telegram group, whose link I have noted down in the description. Thank you.